I'm Joe Murray, a gastroenterologist in the Celiac Disease Program at the Mayo Clinic, Rochester. And with me I have my colleague, expert dietitian, Jacalyn See. And today we're talking about the challenges to being diagnosed with celiac disease and starting on a gluten-free diet for the first time. So Jackie, we're seeing more and more patients who are being diagnosed with celiac disease. And of course, when I see them, I want to send them to you so that they get started in the right way. Tell us why an expert dietitian, registered dietitian consultation is so important to the treatment of this disease.
Well, a registered dietitian who is familiar with celiac disease knows all the ins and outs of the diet, all the details that some people might overlook. One of the leading causes of non-responsive celiac disease is inadvertent or unintentional gluten ingestion, and it often occurs when people aren't well educated about the diet. The dietitian can also make sure that you're getting all the nutrients that might be lacking in a gluten-free diet, and tailor the diet to your specific needs for your lifestyle, eating habits.
Now, one of the challenges we now see is a lot of patients gain weight or are perhaps already overweight at the time of diagnosis. You want to talk a little bit about some of the challenges of helping people not only achieve what we require for their celiac disease, that's being strictly gluten-free, but also, how do they manage their weight, or what are the concerns particularly about weight now that you now see when seeing patients with celiac disease?
Okay, it's much more common than in the past to see people that are overweight or even obese at diagnosis. And once they start the gluten-free diet, some of them will gain even more weight. Some of them do lose weight because they're eating more discriminately, but oftentimes they gain weight because their intestine is healing and they're absorbing more efficiently. So this is something else we can discuss in the consultation, is how to avoid weight gain after going on a gluten-free diet. Some of the gluten-free products tend to be higher in calories than standard products, and with the increase in availability and quality of the gluten-free products, people are tending to eat more of those products than in the past.
Super. So
weight gain can also have can lead to wherever their weight gain goes, usually diabetes or metabolic syndrome follows. So there can be some unhealthy consequences.
Okay. So Jackie, one of the things that I hear now is that there's that patients now meet a lot more familiarity with the gluten-free diet. In the old days, there was nothing out there for patients with celiac disease. There was no awareness of gluten-free, but now there's been this kind of embracing of the fashion of a gluten-free diet. How do you think that's impacted the newly diagnosed patient with celiac disease?
Yes, a lot of people are choosing to go on the gluten-free diet because they think it's healthier, or they think it'll help them lose weight or increase their energy or increase their athletic performance. This can be good and bad. The restaurants and food manufacturers are responding to this by offering more gluten-free options, but sometimes they don't take the person with celiac disease as seriously, and that can have negative consequences.
And what are some of the strategies you might tell a patient with celiac disease to employ, for example, when they go to a restaurant and they have to be gluten-free? What type of words should they use, or phrases should they perhaps use?
Well, I would first identify myself as someone with a medical need for a gluten-free diet, celiac disease or gluten allergy, because a lot of people don't have to worry about the health consequences. And watch out for terms on the menu that say gluten-friendly or low gluten, because they might not be gluten-free. Ask questions about how the food is prepared and also how it's handled for cross-contamination.
Okay. So what type of follow-up do you suggest for patients with celiac disease? You see them, you advise them, you get them started. How helpful would it be for them to come back and see you again after 6 or 12 months?
I think it's a good idea to see them, well, maybe initially at 6 weeks if they have a lot of questions or issues. Otherwise, 6 or 12 months, because once they get home, they think of a lot of questions that they didn't think of in the office, and they start experiencing challenges, eating out, getting their family on board, and so forth. So I think it's definitely important to have follow-up.
Okay. Well, Jackie, thank you very much. So that's all from us. Thank you for your attention.